Good afternoon and welcome to the Multicultural Media Online Conference, hosted by the Ministry of Health, Multicultural Health Communication Service, with the support of Multicultural New South Wales. Thank you very much for joining us. I'm Jesusa, Helaratne, Deputy Director of the Multicultural Health Communication Service. And today we are focusing on breastfeeding week. Actually, today from the 1st to the 8th of August is World Breastfeeding Week, and the theme is breastfeeding support for all. And we're very pleased to have with us, joining us today, Dr. Shanti Raman, Senior Clinical Advisor of Child and Family Health from the Ministry of Health. And she is also holding a different hat. She's wearing a different hat, and she's also the Director of Community Paediatrics from Southwestern Sydney Local Health District. Dr. Shanti Raman, thank you so much for joining us.
Hello.
And we're pleased to have a child and family health nurse from the New South Wales Refugee Health Service, Julia Shadid, who's joined us today to shed some light and tell us how the communities are responding to breastfeeding and the messages that we should be sharing. So, Julia, thank you for joining us. And before we start, we'd like to acknowledge the traditional owners of the land from which we are all meeting from today. We pay respects to elders past, present, and emerging, and pay respects to Aboriginal colleagues and communities. We also would like to acknowledge the multicultural communities and refugee communities who are represented and joining in this session. Now we will start with all the questions. It really is an exciting week because it raises awareness about how important breast milk and breastfeeding is for young mothers and for families. It is not about just the mother, isn't it? It is about the community. So, but before we start, Dr. Raman or Shanti, before we got into breastfeeding, it still is influenza season. So even though we're in the last month of that season of winter, can you tell us what we are currently seeing here in New South Wales with viruses such as COVID, influenza, and RSV?
Well, it is winter still, and so COVID-19 activity has continued to decline, and it's now at a low level. But influenza has also declined, but has remained at a high level in the community. With respect to RSV, which is a big consideration for little babies in particular, RSV has continued at kind of a moderate level from all the indicators we know, from the information we gather. The other bug that is around is pertussis, which is whooping cough, and notifications in school-going children has increased just over the last week. And some of you might know we have gone through a bit of an epidemic of Mycoplasma pneumonia, which is another little bug that causes respiratory infections. It comes every few years, otherwise it's in a low level, and it has affected quite a lot of children.
Well, thank you for that update. Now, beginning of August, as we said, and this is the last day of World Breastfeeding Week, but that doesn't mean that we stop continuing the messages. Now, the focus of today's forum, what are some of the things that pregnant women or new moms need to know about breastfeeding?
Well, first of all, breastfeeding is it gives your baby the best start in life. Breastfeeding is a process and a skill that both mom and baby will practice. It's not easy for mothers to straight away to know how to breastfeed or for baby to attach. So for that, there are support out there. There is in-person, online and phone support that can give mom that sort of help.
I wanted to ask you, what is it, your role? It's very important, being a child and family health nurse. What do you do? What is this role? And what support do you provide for young mothers?
So the role of child and family health nurses is to give support to parents. So if we talk particularly about breastfeeding, there are drop-in clinics. There are even, phone helpline that nurses can answer questions for mom. We do home visits as well. So usually that is done between the 1 to 4 week, when baby's 1 to 4 week. And during the home visit, we discuss, we check baby's health, development, and we weigh baby and see if the baby's putting on weight, and look at breastfeeding, how breastfeeding is going, how attachment is going, and positioning, if mom has any questions that she wanted to discuss. And we look at her well-being, what supports there are there to help her and support the mom.
Wow, what a valuable resource. Dr. Shanti, you are the director of Paediatrics, and you also have this role with the Ministry of Health. Tell us about your role and both in the community and also within being the developing resources and also planning.
So in my role in the ministry, it's as Senior Clinical Advisor, Child and Family Health, and that's really about ensuring that all the programs and policies that we roll out in New South Wales Health is bringing out the best, optimizing children's health and development in the first few years of life. Our big focus area, as you know, is the first 2,000 days. And we are very focused on ensuring that babies have the best start in life and that they are optimally developing and reaching their full potential. And the best way we can do it is to ensure that all the programs that are available via New South Wales Health, so free programs, are evidence-based and doing the right things to support children and families to realize their whole potential. In terms of my other role as Director of Community Paediatrics in Southwestern Sydney, it's the largest health district in New South Wales. We have a very multicultural and vibrant population there, but there are also lots of pockets of disadvantage. And so that role is to ensure that we provide excellent child development, disability services, and services for children and families at risk, pediatric assessment, and pathways to intervention and support.
Two very important roles. And I think Dr. Shanti, Dr. Raman or Shanti, what if people are undecided about breastfeeding? And this is evidence-based, as you mentioned, and also there are those who are disadvantaged who may not know the value because it gets busy. I think that's what happens. People are, we've heard in some consultations and some feedback that they want to, the young mothers want to do it, but it gets harder sometimes with life when things get busy.
Oh yeah, it does get busy. And I think that culturally, we're not doing enough to support breastfeeding as a community, as a society. Let me just tell you about the benefits of breastfeeding. If we were to try and bottle breast milk or create breast milk, this perfect food and medicine in one shot, we would not be able to do it. We could spend millions of dollars and we couldn't come up with this product. It's impossible to do because breast milk is uniquely kind of tailored to the needs of that baby. So there are so many benefits to breastfeeding, both for the mother and the child. Starting with the child, as a pediatrician that supports children's rights, I think we need to support a child's right to have the best start in life, and nothing better than breastfeeding. So breastfeeding, we know as an intervention, can prevent over 800,000 child deaths. And this is from the best available evidence we have from across the world. Breastfeeding can help protect your baby from various types of sickness, everything from gastroenteritis to asthma to some allergies. It boosts your immunity. It supports infant microbiome. It reduces obesity. It reduces also the risk of type 2 diabetes. And most importantly, boosts babies' brains. So that's terrific. But breast milk is not just breastfeeding. Breast milk or human milk has fantastic benefits for premature babies, for instance, reducing the risk of things like bronchopulmonary dysplasia and necrotizing enterocolitis, big terms, but for gut and lung problems. which are very common in premature babies, then there are all these wonderful benefits breastfeeding can confer on mothers. So in terms of mothers, we know it helps mothers' wombs get back into the normal size. There's so many other benefits. Reduced risk of breast and ovarian cancer, also lowered risk of type 2 diabetes. It helps contraception in many parts of the world. Breastfeeding is used as a way of delaying the next pregnancy. And of course, breastfeeding is free, it's portable, it's safe. You don't have to do anything in terms of sterilization. And it's great for the environment. I mean, I can't believe we haven't pushed the environmental benefits of breastfeeding. So we think that we know from the available evidence that exclusive breastfeeding for the first 6 months is really what we are pushing. But any breastfeeding we would be happy with, and we would love breastfeeding to continue right up to 2 years, which is recommended by WHO and UNICEF. And we really need to support this notion that breastfeeding is normal or natural, but it can be, you need to learn how to do it, and you need to be supported. And I can talk a little bit more about that.
I think that term, it takes a village to raise a child, is exactly what this explains of how people should be supportive of breastfeeding. And that means the people around you, your families.
Definitely takes,
yeah.
I mean, give yourself a minimum of 6 weeks to establish that breastfeeding. Both you and baby will be working towards that. So baby learning how to attach, suck, and mom as well, the positioning and the latching.
And I'd like to ask you about that, Julia, in terms of, a new mother who's had a new baby, and what happens in the beginning of breastfeeding, and what can mothers expect, and what could the people around the family and the mother do to support?
Well, breast milk starts developing while you're pregnant. So at first, a milk is called colostrum when it first comes in. This is gold liquid. It is rich in nutrient. It is concentrated. It is very vital that the baby gets that colostrum. At about the third or fourth day, the breast milk then starts to come. So it'll be thinner, but that's not to say that it's any less nutrient. It's just made now that your baby's 3 or 4 days old, your body, your factory has made specific milk to suit the age of the baby. And you might find your baby is feeding for longer, more often. And yeah, so this is, you're definitely giving your baby the best nutrient, the complete nutrient, the human milk that your baby can have. So like I said before, if you find yourself that you're struggling with breastfeeding, whether it's at night at 2 a.m., what do? At first point of contact, you can call their Australian Breastfeeding Association. They do have a 24-hour helpline. And there's well-trained counselors, breastfeeding counselors that answer these phone calls and guide you through what you can do. But definitely also there is the support of the partner, support of families, making mom comfortable, encouraging mom, recognizing that it is a process, and it's a difficult process, but it can be learned and you can enjoy it. It definitely does strengthen the bond between mom and her baby. And it's so beautiful to have that mutual eye contact, to have that time with your baby. So definitely the family needs to be supportive. The partner needs to be supportive at this time. And know as well, like if you're in the community, if you're in a shopping center, or a lot of the places now have specific breastfeeding or parents' room that you can sit on chair, or if they've provided the couch, and breastfeed your baby. There's also the option of having a breast pump where you can, pump milk and give the baby, as long as they're getting the breast milk, that you're giving them the best.
You also mentioned there are services that the Australian Breastfeeding Association and the Breastfeeding Helpline, but there are other services as well. There's resources in languages that's available.
So there is the New South Wales Health Breastfeeding Your Baby. They've got a web page. They've got booklets as well available in different languages. So I know there's the booklets are available in Arabic, in Mandarin, in Vietnamese, in Nepalese. And also there are Tresillian and Karitani. You can find the numbers of Tresillian, Karitani, Australian Breastfeeding Association. And also, if you need to use an interpreter, there is the translation, that is a translating interpreter service, and that's available as well 24 hours. All these numbers are available at the back of the Blue Book, which every mum that has a baby in New South Wales will get a Blue Book, and you can see these numbers at the back of the Blue Book.
Yes, and you see it on the link being provided, the number, which is the ABA, which is the Australian Breastfeeding Association. There's a helpline, and also there you can call TIS National, and as you said, it's 24-hour translating service available. If you have any questions, please put them on the chat, because we have some experts here to answer your questions. Now, you raised that book, Dr. Shanti. Tell us about that book.
Well, this is one of the resources that Julia just mentioned. ABA has wonderful resources in multiple languages, I think over 20. This one is how breastfeeding works, and it's in Hindi. That's why I brought it along, because I can read it, and it's excellent information. You can go to your child and family health nurse with this book, and the child and family health nurse can actually guide you, because she can read the English version on one side, and the language version is on the other side. So I think it's a terrific resource. There are so many resources available. So it's not for lack of information that we should be concerned about.
And that's right. The breastfeeding is something that the whole family, the whole community can support when mothers. What are some of the ways that partners and families can help a breastfeeding mom? Having a booklet like that really helps when it's in language as well.
Well, I think you've raised a very important issue. We need to remember that success in breastfeeding is not the sole responsibility of the mother. I think there's so much pressure on mothers. It is actually our responsibility as a society, the family's responsibility. So the partner can be extremely supportive. They can do so many things. They can help feed them. They can give them the space to do it. They can learn about what it needs, what supports are needed. We know from the evidence that partner support really helps in breastfeeding duration and keeping and sustaining breastfeeding. And conversely, a partner who's not supportive, or where there's issues like domestic violence and other things, actually that reduces breastfeeding. So it's really important. The environment within the family and partner support is a crucial element. So there's so many things that the partners can do. They can learn about breastfeeding, and antenatal education actually does talk about breastfeeding and breastfeeding support. I remember from our antenatal education a long time ago that, all of these things that we mentioned today were mentioned then. We're talking 20 plus years ago. But I think the partner support is also about, tailoring it to what that mother needs. It may be time, it may be rest, it may be a drink, it may be particular environment. One of my friends, someone to talk to, one of my friends actually made it a policy that, you know, the midnight feed was going to be the dad's job, and she had express breast milk. And when the baby woke up in the middle of the night, it was the father's job to feed the baby with express breast milk. I mean, it doesn't work for everyone, but I think this is the sort of thing that
you can work it out.
Partners can do. You can work it out. Yes.
Even providing nutrition, a cooked meal,
Yes.
water for mum
Yes.
to drink, because we know that mums that are breastfeeding will need to drink more water. Naturally, they get thirstier, and also will be reaching out for more food as well, because their body's using all that energy
to feed another human
feed
being.
another human. Yeah.
Now, there is a question here from Biljana Stanovska. And what are the pros and cons of giving dummy to the baby? Does it soothe the baby's belly when they cry or not?
This is a bit of a contentious. I'm certainly not pro dummy, but there are other reasons to provide a pacifier or a dummy. I mean, you do help the baby to regulate and self-soothe. I know that the breastfeeding groups are concerned about dummy use being something that gets in the way of good breastfeeding attachment. And there are many other things we are concerned about with prolonged pacifier use. So I think we should say that, you know, dummies in the early first few months certainly can help the babies to soothe and to get into a state that helps them with sleep and other things. But there is this concern about interfering with breastfeeding. And I know that internationally there was a very big concern that any posters that involved pacifier use in babies would detract from the breastfeeding messages that we like to promote. So I'm certainly very pro breastfeeding, and I'm not so pro pacifier use. So my biases are towards breast and not dummy.
And mums can use, so other than pacifier, there are many ways to settle a baby.
Yes.
Whether, you know, you're gently rocking the baby, padding, that rhythmic padding really settles the baby, even using their own fingers to suck on their fingers or mum's finger. But certainly I agree with Dr. Shanti that pacifiers are not liked. But look, if it comes, that's the last resort, and you've, you know, tried everything possible. Certainly for the purpose would be just to settle baby, and that's it. Like it comes out because, you know, it's hard to keep it clean and sterilized, especially in the first, where you know, when babies are newborn right until they're 6 months, they do need really clean, sterilized bottles that you're using, and dummies as well. So definitely, yeah, I would resort to other ways of settling baby.
Dr. Shanti, we know that breastfeeding can help keep babies healthy. You've said it, it's a bottle, it whether it's from the mom, it's from in a bottle, it's gold, liquid gold for babies. Can pregnant and breastfeeding women get the flu and COVID-19 vaccines, and can they still breastfeed if they do get the vaccine?
Oh, absolutely. So I think the messages about being sick and breastfeeding, you absolutely can keep breastfeeding, whether you have COVID-19 or any number of different viruses. And in fact, as we mentioned before, you don't have to sterilize anything to breastfeed. So it's completely safe, and it continues to be the best way to feed your baby. So the benefits that you're giving your baby by breastfeeding is actually giving them lots of passive immunity as well. So it's much greater than the risk of them catching an illness from you. We strongly recommend, of course, that, you know, mums get immunized for all the viruses that they can get immunized for. Certainly influenza vaccine's been around, and we support that, and so is COVID-19. There is another issue about babies themselves being sick, and should you continue to feed and breastfeed. There are lots of myths around that sort of thing, and I think it's really important for us to remember that if your baby is sick, they actually need more frequent feeds rather than less. And breastfeeding still is the safest thing to do.
Yeah.
And antibodies as well.
Full of antibodies, yes, full of gold, yes.
And what do you suggest? When mothers are sick, what are the, the things that they should be following?
Mums, they can wash their hands with soap and water before breastfeeding. They can pop a mask on. We know that COVID and flu can be passed on from the nose and mouth, so you can cover with a mask. And once you're finished with breastfeeding, take that away, throw it in the bin and wash your hands or sanitize. But definitely breastfeeding or breast milk, is much better than the risk, or outweighs the risk, let's say, than babies catching the illness. If mom is too sick with COVID or flu to breastfeed, mom can pump her breast milk and, get one of a partner or one of the family members to feed the baby. But definitely, if you have COVID or flu, continue breastfeeding.
I have another question, and we said about the society, the community helping your parents, your partner, your family members. A lot of new migrants or patients go to your GPs, and what are our messages for GPs as well? It is important that we're delivering messages to health workers and health professionals as well.
Yeah, I think it's really important. We know that newly arriving migrants and refugees will go to their language-speaking GPs. So it's really important that GPs are selling this message of breastfeeding. I want to bring in the fact that from all the literature around how culturally diverse populations provide breastfeeding. I did a systematic review in 2015, and we've just updated it for 2024. And we're looking at all the culturally diverse, what are the sort of cultural supports for perinatal nutrition. And the big thing was that overwhelmingly most traditional societies, all traditional societies, support breastfeeding. And we know, in fact, in Islam, there's strong support and sanctions to breastfeed for 2 years. So cultural support is very strong. However, there are also lots of messages that are not pro-breastfeeding in terms of, discarding colostrum or the first gold milk. Also things like providing pre-lacteals or the first feeding being something like honey or a medicine or something like that. There are also messages about, what you do when your child is not well, reduce your breastfeeding or stop breastfeeding. So there are contradictory messages that are provided by culturally diverse communities. The other thing is that culture is change. And when you change where you live, you will change your behavior and it becomes culture. And so we know that in many of our culturally diverse populations in New South Wales, many of them, they have to relearn breastfeeding now, even though traditionally they would have strongly supported it. So our GPs really, they're the frontline primary healthcare providers. They really should be pushing breastfeeding as the simple, most effective public health intervention that we know for children today.
Well, thank you. I think that's a very important message for the multicultural media, for the health workers, and for the community. There is one question here that is asking, can you suggest approaches, resources, or support services for women who have trauma from previous breastfeeding experiences?
Definitely talk to your child and family health nurse, reach out it doesn't mean that if the first baby, if you had breastfeeding difficulties with the first baby, that it will happen again with the second baby. But right from the beginning, reach out for support. Like I said, whether it's online, on the phone, or in person, but definitely get that support, because it's not necessarily that you will have difficulties again with second-time breastfeeding. Also, if you have identified that, that your first breastfeeding experience, you've had trauma, talk to your midwife and while you're having the antenatal visits with your appointments, and then you will have the child and family health nurse come to your home and discuss that as well with your child and family health nurse.
Look, if you were my child and family health nurse, I mean, you're so calm and soothing. And I think that's so important, isn't it? Because you're such a big support. Now, we've run out of time and there's so many things to do, but it has been a message from Sonam, who said such great messaging on breastfeeding and changing culture around it. So thank you very much to you both for being here. Any last words for our audiences online today? Dr. Shanti.
Yeah. So my last words are, breastfeeding will help you give your baby the best start in life. So that's a big thing. It is natural, but it isn't always easy, and you can learn, and you're not alone. There is help available, and New South Wales Health does have some fantastic resources. I looked at it as a aging woman, and I found them so useful. So I think it's available. Please reach out.
Thank you very much, Dr. Shanti, for being with us today. And Julia.
So breast milk, it's liquid gold. It is human milk made specifically for your baby. So if you a bit of an addition, if you notice that your milk color changes, it's not diluted. It is because now it's, suiting the time of day and suiting the age of your baby and suiting how much your baby will need at this stage.
Mm-hmm.
So definitely get help. You're not alone. If you think breastfeeding is difficult, reach out. There's many support services. Look at the back of the blue book. Reach out to your child and family health nurse, and good luck.
Thank you so much, Julia and Dr. Shanti, and thank you to all of you for listening. I found this very useful and such great information. And breastfeeding is for all. So happy World Breastfeeding Week. Please share the messages to your communities, and you're not alone. Have a great day, and we hope to see you next time.